Okay, ladies and gentlemen, you are welcome. So in today's video, we are going to look at the concept of thyroid gland and disorders associated with the thyroid gland. So a thyroid gland is a butterfly-shaped organ located in the front of the neck. So it has a butterfly shaped. It is found in front of the neck. And the major role of this thyroid gland, it plays important role in regulating the metabolism, growth, and development of an individual. So the proper function of the thyroid gland is essential for our overall health and well-being. So of course, I think if you can see from here, if the thyroid gland is important in metabolism, the growth and development, of course, it is very important for our overall health. Because whenever we have a problem with our metabolism, there will be a disease. Whenever there is a problem with our growth and development, of course, there will be no well-being. So that is why thyroid gland is very important for proper function of our overall health as well as the well-being of an individual. And as you can see from here, this is a thyroid gland, and clearly you can see that it has the butterfly shape. So then the next thing that we are going to look at is anatomy and physiology of the thyroid gland. The thyroid, the thyroid gland produces hormones such as tyrosine. Tyrosine is called T4 and also triiodothyronine. So tyrosine, T4, and triiodothyronine are the hormones that are produced or that are secreted by the thyroid gland. So basically, these are the two hormones that are produced in this uh, gland. So it produces T3 and T4, tyrosine and triiodothyronine. So these hormones, they are influence nearly every cells in the body by controlling energy use. So all our cells in every cells in our body, we generate energy. So therefore, indirectly, either directly or indirectly, each and every cells in our body is influenced by these T4 and T3 hormones because they are very important in controlling our cellular metabolism and controlling energy that we use. And this gland as at the same time is also very important, and we should know that it is regulated by pituitary gland called thyroid stimulating hormones. So we should understand that the thyroid hormones or the thyroid glands or the hormones that are secreted by the thyroid gland are controlled by a master gland. And this master gland is called pituitary gland, or you can call it thyroid stimulating hormones. So we call it master gland because it is responsible for controlling almost all the activities of the hormones. So let's look at it, ladies and gentlemen. As you can see, this is the thyroid gland, and we have, of course, anterior and posterior pituitary gland. You can watch actually from the previous video. And as you can see that from here, this thyroid gland is responsible for secreting hormones like T3 and T4. And these hormones are very important in increasing the cellular metabolism, and it is also very important in growth and development. So also at the same time, it also very important in increasing the catecholamine effect. So this is actually the three major functions of these thyroid hormones, T3 and T4, and they are secreted by the action of the master gland, that is pituitary gland. So then what are the common disorders, overview of this thyroid gland? What are the common thyroid disorders? So the thyroid disorders include conditions like we have, number one, we have hypothyroidism, we have hyperthyroidism, we have goiter, and then thyroid nodules. These are some of the common disorders that are associated with thyroid gland. So these disorders can affect hormone production, leading to various health problems. So whenever there is this disorder, so it tells you that there will be, it might be actually associated with various health problems. Because if there is problem with these hormones, there will be a problem with metabolism, growth, as well as the development of an individual. So, and very importantly, ladies and gentlemen, we should understand that the early diagnosis and the management are essential for preventing complications. So, if you are able to uh, if you are if you are able to diagnose and manage this disease early, so it is very important in preventing, or it will help, or it is essential for preventing the further complications of the medical condition. So this is actually some of the examples of the thyroid disorders. As we can see, this is the normal thyroid from here, and this is, of course, the Hashimoto's disease. And as you can see clearly from here, you can see that there is an enlargement of the thyroid gland, and we call the medical condition goiter. So as we are doing the video, we are going to take each of these disorders of the thyroid and discuss about them. So then the next thing that we are going to look at is hypothyroidism. So the hypothyroidism occurs when the thyroid gland produces insufficient hormones. So if the T3 and T4 are produced insufficiently by the thyroid gland, then the condition is called hypothyroidism. Hypo means lower, thyroidism, so it means lower hormones or insufficient hormones secreted by the thyroid gland, and that is why it is called hypothyroidism. So what are the symptoms that are associated with this hypothyroidism? It include fatigue, weight gain, cold intolerance, as well as depression. So it is commonly caused by autoimmune diseases such as Hashimoto's thyroid, thyroiditis. So Hashimoto's thyroiditis, it is examples of autoimmune disease that is associated, or that is responsible for causing hypothyroidism in our neck. So these are some of the signs and symptoms: fatigue, hoarseness, weight gain, muscles weakness, numbness in hand, brain fog, depression, and anxiety. All these are the medical conditions associated with hypothyroidism. So then the next thing is hyperthyroidism. That is what we are going to look at. So in the case of hyperthyroidism, it is characterized by excessive production of the thyroid hormone. So you see in this case, the hyper means high. So it means in these conditions, high amount of the thyroid hormones are secreted by the thyroid gland. So that is why it is called hyperthyroidism. So what are the symptoms? Often includes the symptoms associated with the hyperthyroidism include weight loss, rapid heartbeat, sweating, and nervousness. So these are the common signs and symptoms associated with hyperthyroidism. Graves' disease is a common autoimmune disease cause, or is a common autoimmune disease cause of hyperthyroidism. So you see, in the case, the Graves' disease is a disease that linked, or that is associated with causing the hyperthyroidism. So you see in the other one, so you see both the hyperthyroidism and hypothyroidism are all occur as a result of all occur as a result of autoimmune disease. In the case of hyperthyroidism is due to Graves' disease, and in the case of hypothyroidism, it is actually associated, or it is caused due to Hashimoto's thyroiditis. So these are the autoimmune diseases that are associated with these two disease complications. So some symptoms of the hyperthyroidism include increased sweating, shakiness, feeling anxious or nervous, unexplained weight loss, rapid heart rates, and more frequent whooping. So these are the signs and symptoms associated with hyperthyroidism. So then the next thing is goiter and thyroid nodules. A goiter is an abnormal enlargement of the thyroid gland and can be caused by iodine deficiency or autoimmune disease. So you see hypothyroidism, hyperthyroidism, goiter, they are all diseases that are caused by autoimmune disease. But in the case of goiter, apart from autoimmune disease, iodine deficiency can also cause goiter. And then the next one is thyroid nodules. Thyroid nodules are lumps within the thyroid that can be benign or malignant. So it's like a kind of cancer. Evaluation typically involves ultrasound, biopsy, and blood tests. So if you want to test this goiter and the thyroid nodules, it involves either you can use ultrasound to detect it, you can use biopsy or blood test. So this is actually a typical examples of goiter. This is where we have a normal thyroid gland here, and then we have the enlarged thyroid gland. So whenever you have something like this enlarged thyroid gland, it tells you that there is a goiter. So then the next one is thyroid cancer. The thyroid cancer is a relatively uncommon form of cancer but has a good prognosis when detected early. And we have different types of thyroid cancer. We have papillary, follicular, medullary, and anaplastic thyroid cancer. So you see, a thyroid cancer, it is a very uncommon form of cancer, but it has a good prognosis when it's detected early. And these are the different types of the thyroid cancer. And then the treatment options for this thyroid cancer include surgery. So you can use surgery to treat the thyroid cancer. You can use also radioactive iodine, or you can use thyroid hormones therapy. So these are the methods that can be used for the treatment and the management of the thyroid cancer. And as we can see, this is a typical examples of the thyroid cancer. I think you can clearly see it from here. This is a thyroid cancer here. This is the thyroid cancer, and this is also a thyroid cancer. So irregular multiplication of a thyroid cells is leads to a thyroid cancer. So what are the diagnosis and treatment of thyroid disorders? So diagnosis involve the blood test for thyroid stimulating hormones, T3 and T4, and imaging studies like ultrasound. So you can actually use a blood test to assay the concentration of T3, T4, and thyroid stimulating hormones. And from there, you will have an idea whether the concentration is low, high, or is within the normal range. So when it is below, it is hypothyroidism. When it is above, it is hyperthyroidism. And you can also use ultrasound to take the image of the thyroid. And the treatment for these disorders include hormone replacement therapy to surgical removal of the thyroid. So you can surgically remove the thyroid, or you can use hormones replacement therapy. So managing thyroid disorders requires regular monitoring and personalized care plans. So then in conclusion and importance of thyroid health, maintaining thyroid health is vital for metabolic balance and overall wellness. Awareness of symptoms and early testing can lead to effective management of these disorders. Consulting healthcare professionals for proper diagnosis and treatment is essential for optimal health. So ladies and gentlemen, this is where I'm going to stop for this, and we are going to have another video for parathyroidism. So don't forget to subscribe and join to my YouTube community. Please, subscribe and join. Thank you very much, and see you in the next video.